I'd like to thank everyone for joining us today for the StationMD Service Information and Education webinar. You'll see on your screen we have 4 presenters today with us. I will give them the opportunity to introduce themselves as they speak so you can identify that name and voice. Also, as I'm sure you all are, we are very distant from each other, so we'll be doing a little more shuffling than we typically do when we're all in the studio at the office. So with that, I am going to turn it over to our first presenter today, Wendy Witzig.
Thank you, Heike. Good morning, everybody. I'm Wendy Witzig. I'm the Deputy Division Director for Community Operations, and I'm just really excited today to be able to share with you an opportunity we're making available to all of our Medicaid waiver participants. The StationMD will provide a virtual kind of urgent care access through telehealth medicine. This is not to replace any medical professionals or physicians that the folks currently are using. This is to supplement their care during this time of urgent need, so that if there's questions that need to be asked and you're not sure if you need to see your doctor or go to the emergency room, these folks are going to be here to help you. It is a 24-hour service staffed by specialty trained doctors that are familiar with our IDD population. So we're real excited to have that kind of expertise available. And Megan will be able to talk you through all the details of how to access that. But just a reminder that this is available to Medicaid waiver participants. The division is covering the cost of the cost for the service, so there's no cost to the individual themselves except for any technology or medical device need that they might want to add to what they already have available to themselves. But everybody will be able to access the service if they only have a phone. So I am going to turn it over to Megan right now, who's the Chief Operating Officer for StationMD.
Wanted to kind of go over our services a little bit, and answer any questions that you might have. We can be somewhat, I think we're kind of a large group, so it might be a little hard to kind of jump in with questions, but I think maybe, Toy, are we just going to have people put questions on the chat if they have questions? Or we'll, at the end, I'll have a point for questions as well, but if you want to make sure you remember your question, I guess you could put it in the chat and we could address it that way if that works for everybody.
Yeah, Megan, we'll have them, if you guys don't mind, if you can just put your questions in the chat, and then at the end of the presentation from Megan, we'll take a little time to do some Q&A, and then we'll go over, after Megan kind of reviews what StationMD is as a service, we'll talk about more implementation and resources that are going to be around that, and then we'll have a little bit more time for questions.
Okay, great. So we'll kind of dive into the presentation. Am I able to drive the slides, Toy? Sorry.
Yes. Heike, can you give the
bottom?
Okay.
Yes. Megan, you should have presenter privileges. You should be able to advance the slides on the left side of the screen.
Okay, got it. Okay, perfect. Thanks. Sorry about that. Okay, so just a little bit about StationMD. StationMD was actually founded by 4 emergency medicine physicians, and the reason that the company was founded is they were seeing on a daily basis that individuals with IDD would come into the ER, often with a lot of complex medical issues, and they would be seen by an ER doctor who was not necessarily trained in caring for individuals with IDD, and they would come in either with a support staff member that may not know the individual, or with the big binder, and then they had a bunch of patients and they weren't able to read the big binder. So what often happens, and I'm sure that you guys have seen this many times, is that you bring an individual to the ER, they end up getting a lot of additional testing that they may not necessarily need. Individuals are often admitted that have IDD. Individuals with IDD are often admitted far more than the general population just because of that. because of the lack of training with many of the ER physicians. So the doctors just thought, you know what, there must be a better way to do this in terms of caring for individuals with IDD in a better setting. So they formed StationMD so that we could care for individuals in their own homes, so that, number one, they could avoid things like the trauma of transport, being exposed to infections, and just really just the disruption of their daily routine. So that's kind of how the company kind of got started, just to give you some background. And what we've done is our physicians are emergency medicine physicians, but they do have specialized training in caring for individuals with IDD, and we work very closely with a lot of kind of thought leaders around the nation. Dr. Kripke out in California and Dr. Escude, who is actually a member of our board of advisors, who actually develops different training modules for our providers, and they are continually updated based on best practices. So we're very proud of the training that the doctors have gotten, and they're very proud of the work that they do, and especially at this time, they just really feel that it's a great service in order to keep people out of the ER and to minimize their exposure to infection. So a couple of our goals as a company is to expand access to the best kind of quality care that we can provide, and that would be access 24 hours a day, 7 days a week. Obviously, that also does decrease healthcare costs as well, just because you're not having to have an expensive emergency room visit or potential hospital admission. And I think, one of the things that is kind of our biggest goal, and the thing that we're most proud of, is we're really trying to help improve the lives of people with IDD and the people that support them as well. We want to be a resource for all involved. And a few things that make us a little bit different than just like a general telemedicine company, which I'm sure many of you have exposure to telemedicine groups now, where you may call it, from an, as an urgent care thing. Maybe you have a sore throat, or, maybe you have a little bit of an upper respiratory infection, and you kind of get a doctor on the fly. Our doctors when they're on shift. It's almost like they're doing their emergency room shift, but they're doing it in front of a computer. So they're dedicated, to work during that time. Our doctors go by copyrighted treatment guidelines based on what's best for caring for individuals with IDD. And we've developed those guidelines in conjunction with some of the people that I had mentioned, some of the other thought leaders. And we've based those on and developed those based on the most common chief complaints that we've had since we've started this in 2016. As I already mentioned, we have specific doctor training. We also have a pretty extensive quality review program. So every individual that does get transferred to the ER from StationMD, we do review that chart, and then we do spot checking of every chart from every physician. We do a subset of charts as well, just so that we can make sure that the physicians that are working for StationMD are providing the quality care that we expect. Another thing that we are able to provide is educational series. So if you do have a group of staff, or whether that be clinical staff, nursing staff, or support staff that would need to have particular education on a topic, we're happy to provide that. We can develop a webinar that can be sent out through email or put on a learning module. Those can be tailored to individual agencies, individual sites, individual states if needed. And those are things like, we would normally do things like, key changes in condition, on when to kind of call StationMD. We've done specific things on wound care, different readings in terms of like hypoglycemia versus hyperglycemia. So those are just some of the things that we're happy to kind of work with the groups that we're working with, and kind of be a real partner with them. And as you kind of get used to the service and people get acclimated to it a little bit more, that's something that we can kind of get into further as the needs arise. And if we see certain trends, let's say across a particular provider agency, or even within a community that we're working with, if we see a particular trend or particular issue, that would be something that we would kind of bring to your attention and maybe work on getting some education out there. Just in terms of the clinical and economic outcomes that we've seen, why we've been using StationMD since 2016, is that we've had some pretty great success. We've been able to reduce the ER transfers by about 85%, pretty much across the board in all of the populations that we serve, and whether that be individuals are in the community setting with mom or dad, or they're in an intermediate care facility where they may be a little bit complex, more medically complex individuals, or they're in a waiver supported home or apartment setting. Pretty much all of those in all of those locations, we've been able to reduce the ER transfers anywhere between about 80 to 90%. So we're pretty proud of that, and it's obviously great from the individual's perspective. It's saving them from having to get the transfer and getting the exposure, and it does save a lot in terms of healthcare dollars as well. And just to kind of show these are kind of some of the most frequent diagnoses that we've seen since we started, and just to kind of show that, the blue is where we've avoided the ER visits, and then the gray is where we've obviously had to transfer. And just you can kind of see, so some of the things like sepsis, urinary retention, some of those things are very difficult, obviously, to treat once the person gets to that level and gets to be that sick. So what we do try to emphasize during our training process with the staff and even with individuals, that live at home with their families, is to call. We rather have you call on day one when maybe someone is a little bit more lethargic or they're not eating as much and something just doesn't seem right, because that could be the start of an infection, as opposed to waiting to day 3 or 4 where then they become septic and there's not as much that we can do, and then we do have to transfer them to the ER. So that's just something that we do try to emphasize. So just to give some examples, and this is certainly not a comprehensive list, but just some examples of when to call StationMD. And really, in general, we would normally take any kind of call where that is not a life-threatening emergency where you would have to call 911. Any of those other calls can most likely come to us in most situations. There are some things that you can certainly call for, but we're not going to be able to do. Let's say, for instance, someone has a big laceration and they need suturing. We can't suture through the telemedicine platform, unfortunately. So those are things that we wouldn't be able to handle, but we're certainly happy to look at that, determine whether you do need, the individual might need sutures or not, and kind of give you that kind of advice on what to do. But some common examples are you have things that are kind of quick and easy, like a rash or a pink eye, or someone may have a sore throat. And those are, kind of quick, one-and-done types of things. You'll call and I'll kind of go through the process in a little bit, but you'd call the service, you'd get the doctor would kind of take a look at whatever the issue was. They would then, give, kind of write out their treatment plan. A copy of that note would be sent off, and we could talk about that in a second as well. And then they would e-prescribe the medications. And normally that type of process would, the doctor would probably only take about 10 or 15 minutes for something quick and easy like that. But then you might have some things that are a little bit more complicated, like vomiting, fever, a cough, shortness of breath. And those things may be things that aren't necessarily kind of a one-and-done type of visit, where they may say, okay, you're calling about a fever, and especially now with what's happening with COVID, they may say, okay, you're calling, the person has a fever. They appear, their vital signs seem pretty good. They appear to be stable now. But with COVID, we do know things can change, rather quickly. They may say, okay, the person is looking okay now, but I want you to call back. I want you to call us back in 8 hours, or I want you to call back the next day, or maybe I want you to call back in 4 hours. But that would be communicated to the individual, or the individual that's supporting that person, to let them know what the treatment plan is, and then they would be checking in on that person just to make sure that they're progressing in the direction that the doctor wants them to progress. We can also handle a lot of behavioral changes as well. As you know, a lot of the behavioral changes actually have medical underlying reasons. So let's say someone is nonverbal and they have a terrible toothache, but the only way that they can kind of express that is through a behavioral change. So I would really emphasize to call for those behavioral changes, because, the doctors are trained to kind of look for those kind of clues and symptoms. And even if it is just an actual behavioral change, there's a lot of things that the doctors are trained to do in terms of helping to de-escalate that behavior as well. Certainly, if someone is going to be a danger to themselves or others, they would, recommend that the person gets transferred. But a lot of the time, they're able to kind of help with some of those behavioral issues as well. So I would just emphasize to give a call for that. Constipation is a big one, and constipation in an individual with IDD can be very different than it is in the general population as well. So just again, some examples of reasons to call. And then some examples are not always urgent as well. And I think this is a particularly relevant time in terms of medication refills. I know a lot of primary care physician offices are closed, clinics are closed, so it may be hard to get individuals in to see their regular doctors. So we're happy to do medication refills if needed. And it could also just be that, sometimes, people get busy, and it could be a Friday afternoon at 3 o'clock, and people could realize, I don't have enough medication to get through to the weekend. So we're happy to kind of help with that as well. We certainly don't want people having to go to an urgent care or an ER to get a medication refill. The same with any kind of medication order clarification, or let's say someone may have missed a dose and they want to just kind of clarify with the physician on, how that they should make up for that dosage. They can certainly give us a call, and we can walk through that with them. A lot of times we get calls from individuals that may come back from their primary care physician, or even having been discharged from the hospital on a new medication, and there may be some questions or concerns about that medication. We're happy to go through that either with the support staff, the individual, or even with the nursing staff if they have questions about that. Another big thing is, if the return to day programs, a lot of times the docs, their primary care physicians may forget to write that note. We're happy, we're happy to do that as well. We wouldn't want someone to miss going to the day program, which I know a lot of them are closed now, but when they are open, miss getting to them just because they don't have a note to return when they're actually well. So again, those are just some examples. It's not an inclusive list, just to get people kind of thinking and understanding some of the things that we're able to handle and help with. But we really are a resource to staff and to families and to individuals themselves. So I just want to emphasize that really any questions that people have, they should feel free to call us. We really want to be kind of an extension of the services that people already have, and just to be a resource for people. And just a couple of follow-ups in terms of the documentation. So there's a lot of ways to receive the documentation from the StationMD physicians. If agencies themselves have an electronic medical record, we're happy to put that information into that electronic medical record so it's available to all staff. We can send a secure fax to a particular site. And then in terms of people living at home, we can send a secure email and give them kind of access to our system, which would have the note on there as well. And what we normally do is we would get information on the primary care physicians because this is certainly not meant to replace the primary care physicians, and we want to have a continuity of care. So we have the ability to send a secure fax or secure email to the primary care physician as well, so that they can be in the loop if the services were used. And just to kind of go through from a step-by-step perspective on kind of what the process is, we've tried to make the process as quick and easy as possible. So the first step of the process is actually a phone call, just because everybody can make a phone call and people don't need to be nervous about technology from a phone call perspective. So what you would do is you would call on the phone. You would get the service who would either transfer you right through to one of the doctors that are on. If the doctors are all in the middle of, visits with people, then one of the docs would give you a call back. We do our best to try to give a call back within about a 15-minute time frame. I will say with COVID that the volume has been crazy, and we've been trying to increase the number of docs on to kind of keep up with that volume. So if there is going to be a delay, then we'll kind of communicate that there will be a delay. But we do just emphasize that if people have an urgent need, to just let us know. And then we'll kind of triage that and move people to the front of the line. So once you kind of speak with the doctor, they'll kind of review kind of the medical history, whether that be with the individual themselves or with their support staff or a family member. And then the doctor would say, okay, I'm ready to do the telemedicine visit at this point. And then there really is just simply clicking an icon, which would be, or clicking an app, and that would then open up the telemedicine visit. And you would be able, the doctor would be able to visualize the patient or the individual, and then the doctor would be able to see them, and they would be able to see the doctor. So it's a pretty simple and quick and easy process. So what I'll do is I'll kind of go through, one kind of scenario just to kind of give people an idea of what the process looks like in terms of a real live case. So this was a 24-year-old female with cerebral palsy and asthma. They had developed a cough and a fever, and their oxygen sat had dropped to about 90%. So this individual happened to be at a group home. So the facility staff then initiated a call with StationMD. So at that point, the doctor then started to review the individual's medical history to make kind of an assessment of what was kind of looking at what their back history was and if anything had taken place recently. Talked with the staff and then told the staff, okay, we're ready to do the telemedicine visit. The staff then clicks the app or the icon to open up the platform. You can see there kind of in the background where the doctor's kind of in the background doing the exam there with the support person helping them. They do their exam, and if needed, depending on what's happening with an individual, they may need to use the Bluetooth stethoscope. I think for our purposes, we're going to start out in Missouri not using the stethoscope initially. That might be something we add on at a later point. The stethoscope itself is actually not used for every visit. It really is kind of complaint specific. And I will kind of assure everybody that from a COVID perspective, the stethoscope is actually not necessarily an important tool. It's more important to kind of have that pulse ox level and to know the person's oxygen level as opposed to listening to the heart and lung sounds. And if people don't have a pulse ox, there are ways that the doctors can certainly tell, whether the person is getting enough oxygen as well. So I just want to kind of reassure people with that. So once the doctor is kind of done with their exam, they will then kind of develop a treatment plan. If the person, in this case, they thought the person was having an asthma exacerbation and a respiratory infection might be developing, so the doctor kind of ordered the staff to do some additional nebulizer treatments and then e-prescribe some steroids and some antibiotics. And the docs do, as I said, e-prescribing, so they can do that pretty much in any pharmacy across the country, and they would just kind of, ask the staff or the caregiver at home what pharmacy that they would want to use, and then they would just direct that to that particular pharmacy. So in this case, we were able to avoid an ER visit, but again, the doctor did want to do a follow-up just because if this individual's oxygen sat had continued to drop or their fever did not go down, they may have wanted to do an ER visit, but in this case, they did do a follow-up exam, and the oxygen sat went up, and they did their documentation, and they were able to avoid an ER visit. I do want to stress that if we do feel like we need to send somebody to the emergency room, what we would do is the doctor would actually call the emergency room and speak ER doctor to ER doctor to say, hey, we're sending this individual in. They'll give a little bit of history on the individual, and they'll try to have it be much more of a focused exam. What the hope is then is that, number one, there won't be any unnecessary testing, but also that we can try to expedite that ER visit and get that person in and out as quickly as possible. And I see I have some questions, but I think what I'll do is I'll probably just go through quick and then do the questions at the end if that works for everybody. And I'm going to kind of skip over the stethoscope part right now just because I don't think that's going to be that we're going to use that immediately. So I don't think we have to kind of go through the step-by-step pieces of it. And we can certainly kind of revisit that when it gets to that point with the staff or the individuals in the home environment. But as I said, you can visually, you are able to see kind of the how it looks on the screen in terms of what the provider is seeing when they do use the stethoscope there. And it just is another level of diagnostic capability for them. But again, it's not used for every visit.
Megan, do you mind if I pop in for just a second? So I just wanted to know with everybody that the division is working on. So I really want to just make clear for all the folks on here, I don't want anybody to get overwhelmed by equipment and be like, well, we don't have that or we don't have this. when you're looking at the screen in some of these pictures. We wanted to just give you an overview so you could really visualize what a visit would be like. But really the basics for the service is it always starts out with a phone call. So simply you need a phone call, and that truly after that phone call, then it's a decision, either you can use a smartphone, a computer, or a tablet to kind of log in and do that virtual visit. And that's really kind of your basics. So we're working on and looking at more, options and resources to get some of those, more of those items that are the Bluetooth, help me here, Megan, the Bluetooth stethoscope.
Yeah, the Bluetooth stethoscope.
Some of those
yeah,
other
yeah.
stuff.
Yeah. And, there is a lot of things that the doctors can do even if they aren't visualizing the person, just based on the history and kind of having a discussion as well. So I don't even want people to be concerned. I'd rather have people call even if they don't have the ability to use a smartphone than not, because especially now it's more important to keep people out of the ER and more than ever. So there's a lot the doctors can do just via the telephone. And even not even using a smartphone and visualizing. So again, I just wanted, that's a good point. So just to emphasize that, they're pretty well trained, and especially with COVID, there's a lot that they can do just via the telephone to kind of help out and know when that person is safe to stay in their home or actually needs to go to the ER. So I would just emphasize that, definitely start with the phone call. And then we can kind of walk you through the rest of it. And I just want to also just emphasize in terms of getting people, up to speed on if they are able to use the application, on how to use it. I mean, certainly people don't necessarily need any training on using a phone call, on making a phone call, but if people do need help with using the app, which again is pretty easy and self-explanatory, there's a lot of different ways that people can get trained. There's written instructions we can do. We have some training videos we can send out there. We have always open practice sessions, which are great if people just want to call and ask questions as well. We do have a separate kind of phone number that we've set up specifically for the waiver participants if people want to call and ask questions just about the service or about the physicians. And then we do have also a web page that will be put out there as well, so people can go there for questions and information. And then we can also do any kind of remote training with about 24 hours notice individually if people need that as well. So just wanted to kind of put that out there for people. And I think that's pretty much the end, so we can kind of go through the questions now. That works. So the first one is about medication refill. Is it just for medications the PCP prescribe or psych medications? I would say about 95% of the medications we're able to prescribe, even the psych medications. There are some psych medications, as you know, and I'm hoping I'm not a clinical person, but I think it's clozapine, that you do need to kind of have some particular things done for that individual. I think that there needs to be some blood work and EKG that's done in terms of the refill process, depending on, I think it's like a REM certification. So I do just want to preface that some of the things may be a little bit more difficult, but I think those are just kind of your oddities and not ones that would happen. Most of the time we are able to do those refills. It will say if something is a controlled substance, then the doctor would definitely do more of an intense, and I wouldn't say intense, but more of a little bit of a longer exam than they would if they were just doing kind of a regular medication refill. And they would not, I can't really think of an instance, and I can't think of an instance we've done this. It would be a very rare event that they would do a refill for a pain medication like oxycodone or something. That would be a very, 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 very rare event. Maybe someone that was on hospice or something. So just to kind of give you a sense of that, but I would say a majority of medication refills, and even with the psych medications, especially even I know a lot of the seizure medications are controlled substances. They are able to do, but the ones that I just said would be kind of the limitations in terms of, pain medications that are controlled substances, and those very select psych meds that require some additional testing. And then there was another question about multiple users being able to access a single session. Yeah, so multiple people can join. So let's say an individual was maybe at a group home, and mom or dad is somewhere else, and they wanted to join. They can certainly join. The physician can send them a link so that they could either join by phone if they don't have a smartphone or the ability to do video, or if they had the ability to do video, then they could be almost just like we're doing now. We use a HIPAA-compliant Zoom platform, so they would be able to join, and then they would be able to visualize, their loved one and the doctor at the same time. And the same thing for if, let's say if like there's nursing on call from a facility perspective, they would be able to join as well if they wanted to. And then there was just a question about trying to use this to replace primary physicians. Our docs are pretty good about being able to kind of work with people, and especially if we kind of see a pattern. We certainly are not here to replace the primary care physicians, and we're here to just kind of have access to care when the primary care physicians aren't available or after hours. So if we see someone continually calling about, let's say a low blood pressure or even a low sugar reading or something, and it's really something that let's say their insulin needs to get regulated more from a primary care physician, or maybe their blood pressure medication needs to get changed. We'll kind of talk through with that individual or their support person to kind of say, hey, listen, this really needs to go back to the primary care physician. And in some instances, our docs will actually, besides even just sending a fax of the note, will communicate to that primary care physician and just say, hey, I have a concern about, this, and, just to let you know, that type of thing. So just in terms of where to download the app itself is just, there's going to be instructions that Toys Group is going to be sending out. So I don't know, Toy, if you want to field that, or you want me to just...
Yeah. So we'll be sending out. So I'm going to go over, once Megan completes her presentation, we're going to be going over more about how you can expect rollout and information, and that's all coming soon. We've been working all week and getting all of that information together, and that's something that's going to be shared out with you guys this week. So we will have more information coming on that. I do want to go back up, if you don't mind, Megan. I did see one question we kind of skipped over. The question was, who is eligible for this? Anyone eligible for DMH services, or only individuals receiving waiver services? And I'm going to let Gary address that.
Bill, yeah, the question about who's eligible, we're going to enroll everyone in Medicaid waiver, everyone in one of the 4 Medicaid waivers. If we have to expand it at some point, we'll look at that, but right now we're trying to keep it to that waiver population.
So speaking on that, and again, we'll touch on this a little bit after Megan gets through the rest of her stuff. Megan, are there any more questions that you want to specifically address? I know you've got kind of a time commitment outside of here, so I just want to we can answer kind of the more of the DD side ones after you finish.
Sure. So I just wanted to, I guess the one thing is that there will be information about how to download the app, but the app is just on the Apple Store and the Google Play Store for Android. But there will be a specific code that people need to put in. It's not an app that's like readily available for the general public. It has to be something that people get a code for, which people will be getting once that information is set out by Toys Group. But then people are asking also what information people need when they call in. When they're going to call in, if they have a medical issue and they're calling the number for the provider, they really just simply need to be to provide their name. They're going to ask their name and their date of birth and their address. So that's really all that we're going to need to kind of verify that they're a waiver participant.
So we've got some more questions coming in, guys. We're going to continue to field those. I'm going to let Megan kind of finish up her presentation, and then we'll keep having the questions come in, and we'll continue to field those.
Yeah, and I'm pretty much finished. I mean, I'm happy to stay on if you think I could answer any of those questions, or it's up to you.
Yeah, if you have time, that'd be fantastic. If you have other commitments, I don't want to
Okay,
I don't want to.
I haven't. Yeah, that's fine. I haven't until 10, so I'm okay until 10 now.
All righty. Well, so let's go ahead and continue with the questions real quick, and then I know Wendy has just a couple things that she wants to clarify with the group, and then we'll discuss a little bit more. Megan, I'm going to steal the ball from you so I can kind of move the slides a little bit further up, if it'll let me. There we go. Okay. So one of the other questions, is there a cost for the individual, or do they submit their Medicaid or Medicare ID number? So there's not a cost. The division is covering the cost for the service for their Medicaid waiver patients. There will be so when you go to kind of, we're currently creating on and finishing a website. So there will be a website that you will go to that has the information that you will put in. It's kind of your verification information. And so most of the time you need two identifiers to kind of verify somebody. And so Megan is using their date of birth. It'll be the individual's date of birth. And then Megan, what was the other identifier that we landed on?
So when they call for the actual medical service, it'll be their date of birth and their address that they'll be asked by the service answering the phone. But we do on the landing page, if people want to have their primary care physician receive the information, we're just asking to kind of verify themselves either through the DMH ID number or their Medicaid ID number, just so that we can match up the file and make sure we have the correct person in terms of matching up their primary care physician to the correct person. And that can be an and or. So if you have both,
and that can
great.
be an and or, yeah.
Yeah, and if you don't have one or the other, that's fine. You just need one. Okay, so Heike, remind me again of how I advance the slides, sorry.
Sorry, I had to unmute. On the left side of the screen, if you'll hover over there, you'll see, there you go.
Okay, sorry, getting used to this new platform. So I'm just going to scroll in here. I'm going to keep scrolling through the slides. Actually, I'm going backwards. Apologize. Okay, so we're going to kind of, I'm going to turn it over to Wendy now. Wendy has just a few things that we want to kind of verify and really talk about, okay, what's your role? What are we really envisioning for the rollout, and how is this going to happen? So Wendy, I'm going to let you take over and just say your part, and then we're going to discuss the StationMD website, and then discuss when resources and things that are going to be coming out, and really how this first phase of implementation is going to happen starting on the 13th.
Okay, good morning, everybody. Before I say my little piece, I see a question on here I wanted to be sure that we got to before we got away from questions. And if I missed it, let me know. There's a question about, is StationMD specific to physical, behavioral concerns, or oral health? Is oral health an option as well?
Oral health meaning like dentistry?
I'm assuming, well, if they're maybe having some oral health issues.
So if they're having, I would say give a call. If someone has like an abscess or something within the mouth, or even just like a cold sore or something, then we can certainly help address that. If someone needs, like a tooth pulled or something more dental specific, then we would not be able to address that piece, but we can definitely rule out anything that we can address, and then kind of let the support person know, what needs to be done in terms of, getting that person further treatment. Hopefully that answers.
Okay. Thanks. So maybe if the doctor determines that or thinks there may be an abscess and they need to prescribe an antibiotic to get them through the weekend or a couple of days so they can get to the dentist, that might be something they could look at or consider through an assessment.
Exactly. Yep, exactly.
Okay, thank you. So what I just wanted to kind of speak to all those that are on the phone and on this webinar now are folks that we think are going to be on the front lines and may be receiving phone calls from families, probably mostly families, but maybe even some providers that are unfamiliar, haven't gotten the word yet about StationMD. They're skeptical of scams that might be out there and is someone trying to take advantage of them. So I think you guys are going to be on the front lines for receiving some of those calls to find out, is this for real? And we just want you to know enough about StationMD to be able to reassure families and providers that, yes, this is legitimate. The division is covering the cost. There's no charge to you to receive this service during, this time. So it's completely safe if they choose to go along with the service. But it is still a choice of theirs whether they want to use it or not use it. But so don't feel like you have to have all the answers, that you need to have intimate knowledge of what StationMD can do and does. Just know that it's legitimate, that it's a service that will enhance their access to medical care. It does not replace any physician, and that the StationMD physicians will be communicating with the primary care physician and letting them know what assessments they did with their individual and making that communication as well. So that's really what I wanted to speak to here, Toy. So if you want to go ahead and start talking about the rollout.
Sure. So there was one question. I think we skipped it, and I just want to make sure that it was addressed. So one of them says, can an agency nurse be part of a visit from a different location? Example, individual and staff at a group home and a nurse is at the agency office home. And Megan, please correct me if I'm wrong, but yes, that would be able to happen.
Yes, correct. Yep. The doctor can send them a link, and then they can just click right on that and join it.
Yeah. It's kind of like joining, for lack of better terms, but it's like joining a Zoom. And then we also have another question. So I saw it just came in from Bill. Will this be available after, oh, I'm so sorry. You mentioned waiver participants. Are those on, and I'm sorry, that was from Joseph. This one's from Joseph. You mentioned waiver participants. Are those on the wait list eligible? But currently, no, they are not eligible at this time. We only have active Medicaid waiver participants that will be getting this service currently. Another question came in, will this be available after the COVID-19 pandemic ends or just during this time? So the plan is currently right now we have and correct me if I'm wrong, Gary, but it's a 6-month contract to do this. But yes, we are looking at ways that we can extend this out, looking at ROI and different kinds of benefits where we can extend this service out to be more of a long-term supplemental service.
Correct. There are some executive exceptions made during this crisis that allowed us to do this contract. One was being able to issue a contract, around the RFP process, and the other one was be able to use out-of-state physicians that may not be licensed in Missouri, but they are licensed physicians. I just want to be clear on that, but they may not have a license in Missouri. So those are two exceptions. Once the crisis is over, we would have to look at a couple of those hurdles to be able to continue this onward.
So great question. So I want to go in just and quickly talk about some of the communication that you can anticipate. So we have currently crafted some informational letters for the individual families and then also for staff providers. So those letters of information will be coming out very soon. That way, we want you all to receive not only what the information that we want you to have from your perspective, but also what the individuals and families will be receiving as well. We are also creating, and you can see on the slide, it's a StationMD website. I have just a tiny screenshot. It's in development, and we're finishing that. But really what it'll be is that's kind of your home where you can get all the information about StationMD. There's a box that Heike has created. It's click here to go to StationMD. And we're
can I hop in for a minute? I can share this so folks can see what it looks like. I'm going to steal this back from you for a moment.
Perfect.
And, it might let me, let's see. It'll take me just a second, and then it will let me share. Okay, so, Toy, I'll let you talk through it, and then we'll click folks through. This is our main landing page for DD that you all should be familiar with.
So on the main landing page of DD, you're going to see that blue icon that says StationMD, so you'll click there. And once you go there, you'll see a little bit of information. Just it gives you a high level of what StationMD is, and then it talks about the eligible participants, which are our Medicaid waiver folks, and then it talks about really our implementation. So really we're looking at currently implementation being done in 3 different increments. And what I mean by that is we kind of have 3 different rounds of implementation. This initial round, we have targeted about 5,000 total Medicaid waiver patients that we'll be really looking at implementing StationMD with beginning on April 13th. So if you click on, if you want to get to more information, this is going to directly link you out to StationMD's website that is specifically developed for our division.
And no, this is just available right now. We won't have this up and running until everything's in place, but I wanted to make sure everyone had the opportunity to see what they should expect.
Correct, yeah. So until it's kind of ready to go and we have everything up and available, this will just kind of be minimal information, but we will make an announcement and let you know formally when all information is available. So at the top, it's just going to give you information about what StationMD is, how StationMD can help you. I can scroll down just a little bit. It'll talk about how to download the app and how to access the services, how to reach a StationMD physician and the steps to do that. And then below, it's going to have, if you want that provider, so as Megan was speaking to earlier, if you are wanting to make sure that your physician gets your information from your visits and consultations from StationMD, this is where you would put in that information so that they would have accurate information on sending that to the primary care physician. The box is where we're going to have more of our FAQs and information. Those are just all hyperlinked out, so there's it takes you directly to the resource, and then we have our 4 informations and questions. So we just wanted to share a little preview of that with you. So communications will be coming out between now and Monday. We are also working on what's called, and you guys will get a copy of it, it will be sent out to everybody, is it's called a participant packet, and it's what's really going to go to those individuals and families that are in homes to really let them know that, okay, they are part of this service, they can access this service if they want to, and this is kind of how to do it. So that when you might get calls from an individual, a patient, family, something like that, or even a provider, you can say, okay, this is what they have received, and this is how I can kind of help them walk through this. And then this website is going to be one of your top resources. So I want to take just a minute because we did get a question in. It says, I assume the recorded version of this webinar will be available on the division website. Will it be located in the typical webinar area or in the COVID section?
Okay, I'll answer that one. Yeah, we'll put it in both places. We do not typically put webinars in any other location than that webinar file. However, given the fact that we're housing StationMD information specific, we'll make sure that that's all packaged together. Also, it's important to know because there is such a large volume using our event center platform that we host webinars on, it is taking much longer to generate recordings. They're telling us to expect up to 4 days. So know that that package of the recording and presentation will likely not be available on our website until next week.
Perfect. And then just to let you know, for further education, we will be having another webinar next week. Again, just to continue to reiterate the message, to be able to answer questions and things, especially since we're going live on Monday, and you guys might start to get questions. We'll keep the FAQ updated. Again, we have a call number and a specific email from StationMD for questions, concerns, and then you can always email our DD email address as well. So we're here to support you. We just wanted you to have the knowledge and the information to understand not only what StationMD is, but kind of what we're asking. There might be some asks too, in the sense of, you know, having a accurate email address for our individuals and families is going to be extremely important, as well as a phone number. So there might be some concerted efforts as we continue through planning and implementation to kind of get the group together to help us kind of get some of that contact information. So More information will be shared. Again, we will make sure that it's shared widely and broadly, and then everything will be routed back to this website as we do with most other things that comes out from the division.
So I'd like to add one comment to a question that was asked earlier.
Sure.
There was a question about the doctors and are they licensed in Missouri, and the response was no. We've got some doctors already do have their license in Missouri, but others are from other states, and they may be from nationwide. So during this time, there was a federal waiver of requiring a state licensure for a doctor to be able to practice medicine in Missouri. They now have reciprocity that they can practice medicine across the country, so you don't need to worry about if the doctor has a specific Missouri license. They're all licensed physicians in whatever state they're in.
Okay, there was a question. I'm not sure that we've addressed this one either. And again, if your question wasn't answered, we will make sure to pull these questions down and make sure that they are addressed. From a case management point, we were told that this would be rolled out in phases. That is accurate. How will we know which of our waiver clients have access to this program? We'll be sending out lists so people know who's in what wave. Also, is there anything we can do such as put a budget or something else in Seymour? I'll let Gary speak to the budget piece, but as far as Seymour, one thing that I can think of, and Gary can add to this as well, to the Seymour piece, is that if you can get updated contact information. So if you're out there and you're gathering and maybe on your ISP or different documents you've gathered more accurate current information, but you haven't had time to enter it into Seymour, it would be extremely helpful as we continue, because we're pulling these lists from Seymour and these participants out of Seymour. So if we have accurate contact information, that just makes it a little bit easier and flows a lot better to be able to get the information out to these folks. So that would be my ask, and Gary, I'll let you add anything to that.
So there really is no change to the UR process or to the budget in Seymour. There's no cost to the individuals. Right now, the division is covering the cost of it. We're enrolling individuals from our end, so there really doesn't need to be a budget change in Seymour. And as Toy was mentioning, you know, for the in-home folks, especially if we haven't been doing the service coordination for them for years, our contact information may be out of date, or I know, you know, for a fact it is out of date on quite a few individuals. So as we generate these lists, we're going to be reaching out to TCM agencies to help us get the information accurate. And so just be looking for that, because we want to make sure we contact as many people as possible, let them know this is available. And we may try different methods of contact. And so we're working with UMKC on that. They have the family-to-family program, and they're using some of those utilities to help us contact individuals.
And so the other thing I want to mention, so I make it clear, so that it's clear, because I know some of this is a lot of information in one setting. That's why we're going to be doing a repeat webinar just to cover everything. Is I also wanted to just cover in the fact that the Medicaid waiver participants, so basically all of them are eligible, but as we do our phased approach, and for right now, the approach, and if there are any changes or updates to this because of the impact of COVID, we'll let you know. But currently, really what we're looking at right now is there's around 15,000 Medicaid waiver patients. So we're looking at doing buckets of 5,000 of those patients at a time in those buckets between the provider agencies and homes. So our plan is really, once we have that list, it's a list that's submitted to StationMD, and they are, in a sense, think of it as they are pre-registered. So when this goes out and the information goes out, those folks are, in a sense, pre-registered, and they're ready to, if they want to access the service and utilize the service, they can, but if they don't want to, they don't have to. The other thing that I want to make very clear is just because somebody at the beginning or in their first phase of enrollment or their first phase of implementation does not choose to utilize StationMD, it doesn't mean at a later date that they can't come back and say, yeah, actually, I've thought about it, and I think we would like to use that. So I don't want anybody to think think of it as an open enrollment. I hope that makes it clear. If you have questions on that, let me know. So I did get one. When will the last wave be enrolled? I really think we have a strong goal of getting folks in as quickly as possible. I don't want to give a date to disappoint anybody, but we're working as quickly as possible to stay ahead of the peak in Missouri for COVID-19. So there's another question. Will the phase be done geographically all over waiver? So all waiver participants in a specific area will be enrolled at the same time. So really what we did is, and Gary, I might have you, will you kind of explain the first bucket of the Medicaid waiver participants that we chose?
Yeah, sure. So we chose some large residential providers and some who are actually experienced positive cases at this time. But the process is a little different for the residential provider, as the actual agency is registering some of their contact information and their site information directly with StationMD, so that they're managing the intake process for the individuals. So a lot of what we've been talking about today was for the in-home families, where we need to try and reach out and hit them directly. So we picked 5,000 to start with. We thought that was a good number to make sure we had capacity, available day one. We ended up with about 1,300 residential consumers, and then we looked at, the balance, 3,700 in-home. We chose the St. Louis, Kansas City, Central Missouri area that seemed to have the highest occurrence right now of positive COVID cases in the general population. And then to round out the 3,700 then, but we also went into the Springfield area and picked up some in Springfield. Just looking at those day services, type service plans, PA, day hab, CI, home skills, those types of services. That was our initial priority group, and then I think, as we mentioned earlier, we're going to get all the rest of the waiver population up pretty quickly. But that was the group we wanted to start with. We wanted to start with a limited group to make sure our process is down, and then we're going to hit everyone else.
So those are all great questions, and again, we will be sending out that informational letter to you all very shortly. I'm hoping that it can get out today. If not, it will be coming out tomorrow, because we want you to be prepared. Our goal is to make sure you all are prepared before your medical waiver participants may contact you. So that is the goal, and that's kind of one of the reasons why I do apologize that this webinar was kind of quick and in a hurry, but we will give you much more time to plan, and we will choose an afternoon slot for next week's webinar. So I know we're getting close to time. It's 8:58. I see one more question. We'll go ahead and take one more question, and then we will close, but you can continue to send your questions to either myself, this is Toy, or you can send it to our DD email, and we'll fill those. But just know that more information is coming, and we do have the website that will be up very shortly. I'm hoping by tomorrow morning, and that way there's a lot of resources and information that you can access to really get your questions answered. So this has been great. And again, you'll have another opportunity for Q&A on next week's webinar as well. It says, this last question, it says, does SC role change for individuals with residential provider from what you have talked about? If so, can you say more about what is for those with residential? So Megan, so our focus of the webinar today, and I'll be honest with you, is more of our in-home folks, but for the residential, we will hit on that next week. But Megan, I don't know if you want to talk about that. It's a little bit different, but not much. So Megan, I don't know if you want to speak to that.
Sure. Yeah. It's not dramatically different. It's just like if it in the for the providers that with the support staff is usually the ones initiating the call. So we just need to do a little bit of certainly just give the support staff some training on when to call and that the service is available so that they're aware. And then we would basically just walk the support staff through the exam, so with the individual, so that they can that they can then help. And then we do have the ability to send, the information back to that individual, home within that agency. And then if there's people within the agency, overall managers within the agency that wanted to get notification every time a home, one of their homes calls the services, we're able to do that as well. So it's just kind of another layer of communication so that the provider agency can kind of be aware of the utilization within those homes. Hopefully that makes sense.
Yeah, that makes sense. Thank you, Megan. Okay, so we are at 9 a.m. I do see one more question. We'll try to, Heike, can we try to squeeze that in really quick?
Yes, that's fine.
Okay. It says, will you pull the individual's personal date info from Face Sheet and Seymour or the Medicaid demographic page?
So
Gary,
this is Gary. So that's a good question. We pulled the Seymour Face Sheet data. But I wondered also about the Medicaid demographics. If we think the Medicaid demographics is more accurate, we can also look at that. So if some of you have an opinion about the Medicaid demographics being more accurate, let us know. We can certainly compare them and pull it if it's more recent.
Okay, perfect. So thank you all. This has been a wonderful Q&A session. We appreciate all the information coming in and the questions. We will continue to work diligently to make sure that you have the information you need. And we're very, very excited and thank Megan for her time today in presenting more information around StationMD. And we want to thank you all for helping us coordinate and push out this awesome service to our Medicaid waiver participants. So with that, I think we'll go ahead and close. And we'll talk to you all soon, and have a great day.